you mentioned this was a forced dose titration, which isn't necessarily finding the optimal dose for each patient. And when you're prescribing as a physician for a patient, you're trying to find the balance between efficacy and tolerability, right? So
Right.
so these patients may not have been exposed to the best dose. Why don't you talk about for a minute how easy or hard it is and the benefits of finding that right dose and determining that balance?
Well, it's really important. And the way the FDA has us do these fixed dose studies, that's not the way we practice. You start at a low dose and then you move up gradually till you get just the right dose of medication. And you balance tolerability and efficacy, as you said. Well, what does that mean? Well, you want good symptom control, but you also want to minimize the side effects that people have. So I always say this is a no zombie zone. And sometimes I'll see people after school and they're just all over the place and I'm thinking, oh, you may not be on enough medication. And then I'll see them at 10 o'clock in the morning because it's a day off school and then they're really quiet, they're sitting there, they're doing their work. Well, why is that? Do I need to go up on the dose of medication? Well, I thought I did when I saw them in the late afternoon or early evening. But what I was doing is I was seeing them after their medications were wearing off. And that's probably why they were a little snarky with me too, right? Because you have some of that irritability as medication is wearing off.
Right, and I think that what you just said illustrates the point of having timed doses for different parts of the day because your behavior can change radically depending on how much drug is in your system.
Right. And if I'm saying, oh my goodness, your medication's wearing off too soon, one of the things we can do is we can increase the dose of medication because we know that's going to make the medicine last longer. But then the dose may be too high when it's at its peak during the day, and maybe Johnny is just sitting and staring and not getting any work done. Maybe Johnny isn't eating very well, so he's losing weight because he's really getting too much medication at lunchtime when he's getting just the right amount of medication later in the day. So you really need something that balances the patient's symptoms with how well they're tolerating the medication. Because if people aren't tolerating the medication, they're not going to continue taking it.